Okay, so as a clinic nurse, you are caring for a patient who has been prescribed an antibiotic for tonsillitis and has been instructed to take the antibiotic for 10 days. When you do a follow-up call with this patient, you're informed of the parents. You're informed that the patient is feeling better and is stopping the medication after taking it for 4 days. Where have you heard this before? What information should you provide to the patient? Okay, so we've looked at the question. Now, when you're thinking the question, you're trying to go through the nursing process and just think about what part of the nursing process that is. Okay, what do we know about this case study? What is the subject? And what's the query of the question? Okay, what do we know about antibiotics? And what do we know about teaching related to antibiotics? What are common things that we need to know? What are the what are the common actions of antibiotics? What are reasons why they use antibiotics? Just think of things like that. And then when you're thinking about the answer, think about worst case scenario. If the patient takes the medication, what will happen to them? If they don't take the medication, what will happen to them? So these are some things that you want to think about as you think about going through the question. Okay, so again, I'm gonna go ahead and read the question. As a clinic nurse, you are caring for a patient who has been prescribed an antibiotic for tonsillitis. And so what do we know about tonsillitis as well? And has been instructed to take the antibiotic for 10 days. When you do a follow-up call with this patient, you are informed that the patient is feeling better and is stopping the medication after taking it for 4 days. What information should you provide to the patient? The options are: keep the remaining tablets for an infection and later time. Discontinue the medication if the fever is gone. Dispose of the remaining medication in a biohazard receptacle. Finish all the antibiotics to eliminate the organism completely. If your ladies are there, I just want to see if you want to answer in the chat what you think is the answer for this, whether it's A, B, C, or D. I'm going to give you a moment. Answer the chat. So for the answer for this one is, we're going to go with answer D. So the nurse informs the patient about the need to take, you need to inform them about the need to take the full dose of antibiotics. Okay, so usually when a person takes antibiotics, they usually start feeling better within 2 to 3 days. Now, part of your teaching, your discharge teaching or your planning, is that you are going to, if you are an RN, then you're going to teach them to use the antibiotic for 10 days. And then if you're a PN, depending on whether it's a standard or care, then you're going to reinforce the teaching of taking the antibiotic for the full 10 days. Okay. And then the goal is to eliminate the microorganisms. Okay. So most people, after they feel better, they stop taking it, but you want to encourage them to do that. Okay. Patients should never be instructed to keep leftover antibiotics, okay, for use at a later time, because when they need antibiotics, they need a full dose of them. So it's not like Tylenol or Tylenol 3 where you can take 1 or 2 and then use it for another time. The antibiotics need to be taken the full dose of medications. So even if the fever or other symptoms are gone, the medication needs to be continued. Now, it is correct to be disposed of in a biohazard receptacle. However, the priority information is to finish all the antibiotics to eliminate the organism completely.